So the slide says 3 types, but really 4 types of coronavirus vaccines. And so we have on this left-hand side, the virus is like a sphere and has some spikes. That is the spike protein. So the virus uses that spike protein to attach to our cells, and then that's how we become infected. Then once the virus is inside our cells, then it is going to multiply. So the way we could develop immunity without getting the infection is through vaccines. And the oldest way is to have an inactivated virus being injected into our bodies, and then our body's going to recognize that as foreign and develop immunity. And next time we see it, we already going to know what it is and fight it. But there are 3 other ways. One is a protein base or protein unit. In this case, the spike protein that could be presented to our bodies. We can develop immunity and then fight the virus the next time. Or we can have a purified gene that encodes for the spike protein, embedded into another virus, the adenovirus, that is going to serve as transport. And then it is going to be delivered to our bodies. We're going to produce the spike protein based on that gene, and then our immune system is going to recognize it as foreign and develop immunity. And the last one would be, since we already know the genetic sequencing of the virus, take a little piece of mRNA, which is like a template. It's just a code, a single strand of a code that is going to it's a template for a piece of the spike protein. And then if we present that to our bodies is going to make that little piece of the spike protein, and our immune system is recognize it as foreign and develop immunity. So Pfizer BioNTech, a German-based company, so they were able to develop these vaccines in only a few months, 8 months. So the makers of these vaccines already had the gene sequencing for the virus early in the pandemic, and they only had to get a little piece of mRNA, which is the template, and by injecting that in our muscles, in the arm, so that that code is gonna make our muscle cells to make with that template the little piece of the spike protein. So it is the muscle cells or nearby immune system cells also. They could produce the little piece of the spike protein. So our body's gonna recognize that as foreign, and then we're gonna develop the immunity. So the mRNA is just a little piece. It's a little template of a little piece of the spike protein. So it's a Snapchat message that expires. It is not going to become a permanent part of our bodies, as some people have suggested. These are just temporary messages, instructions for our cells to make this little piece of the protein. It takes about 25 different proteins to make a coronavirus. So having just a little piece of one protein is not going to change anything inside our bodies. This mRNA piece is very fragile, so it needs to be encased in a lipid substance. Otherwise, it's going to melt down. So that's why this Pfizer vaccine needs to be kept refrigerated at minus 96 degrees Fahrenheit. That means that we need equipment and special fridges to transport and store the vaccine. The vaccine is shown to be 95% effective in clinical trials. And Pfizer is now working to show that this vaccine can prevent all infections, including those that do not cause symptoms. Side effects are mild, fever, headaches, muscle aches. A few people have developed severe allergic reactions to the vaccine components. The vaccine is given in 2 doses, 21 days apart, to all those who are 16 years of age or older. The second dose could be given 21 days with a 4-day grace period. Could be given 4 days before the 21-day mark. if the minimal interval is violated. So it should be considered that the patient has been vaccinated, even though the data is not enough. And there is no maximal interval between the first and the second dose. The Moderna vaccine, the vaccine sponsored by the NIH, is another mRNA vaccine using the spike protein. And the spike protein was chosen because it doesn't mutate or change as much as time goes by. It does appear to remain stable through generations and generations of viral replication. This vaccine, Moderna vaccine, shown to be 94% effective in preventing symptomatic infections. And the company says that they have data showing the vaccine also prevented all infections, including those that do not cause symptoms. The vaccine is given in 2 doses, 28 days apart, to those 18 years of age or older. People vaccinated with these 2 mRNA vaccines, no one had died after, even if they were infected. So these mRNA vaccines are not interchangeable with each other. So if you get the Pfizer vaccine the first time, you have to keep with that one. And also, you cannot get any of the other vaccines we mentioned interchangeably. These mRNA vaccines should be administered alone. You should wait at least 14 days before you use any other vaccine, 14 days before or after. And finally, the last slide is in regards to the ingredients. In these 2 mRNA vaccines, they of course have the mRNA piece and the lipid cover. The polyethylene glycol is the main one. Some people are allergic to that component. It is a component in other medications and also and PrEP for colonoscopies and things like that. So some people have been sensitized with that component. The vaccines have salt and sugar, more so on the Pfizer, and so the labels saying that people should be made aware if they're allergic to any of these components. There are no preservatives or latex in these 2 vaccines. There's a little bit of differences in the components. If somebody is allergic to one of those components, they should pay attention to and read the components before they get the vaccine. But other than that, it should be they are pretty much the same. People complain about getting a sore arm. Some others a little lymphadenopathy in the armpit, and most people say that 24 hours later, in my case particularly, also I felt like a little tired, a little bit of muscle aches maybe, but that was about it, and they went away within hours. Some other people have reported fevers, headaches, and the side effects that people are most afraid of are allergic reactions. There are a number of allergic reactions related to the vaccines, anaphylactic reactions. So if people have reacted to any of the components of those vaccines, they should not get the vaccine. If they had an allergic reaction to any other vaccines, they should be watched closely while getting these vaccines. And there are protocols already in place, exactly what to do and how to screen people for possible allergic reactions. So there are people developing allergic reactions to all vaccines, and there seems to be a little more with these ones. But we are given, say, I think there have been so far less than 15 cases of severe allergic reactions and given millions of doses already. So nobody has died from any of those severe allergic reactions. So there is, it is part of the the side effects and the potential issues with the vaccine. And it is probably more so than any other previous vaccines, but it's still a very low number compared to the number of millions given. That there's a new variant of the coronavirus, and it seems to be that these vaccines, these mRNA vaccines, are gonna protect us from those variants as well. But I said in the future the virus mutates a little more. The technology is such that they could tweak the vaccine a little bit, the mRNA, and that could make it enough to cover whatever strain is around in the area. So it seems to me that the vaccine is going to cover us for at least a year, hopefully longer, but at least 1 year. So we're going to have to, I mean, there are going to be studies still ongoing. Pfizer and Moderna continue to do studies and see. We may need a less amount of the dose, not the full amount. We may need only 1 shot instead of 2. So they continue to test different options. But so far, at least 1 year, hopefully more. And then in a year from now, we'll see what is going to happen with it. We're going to need a booster or another series of the shots. Yeah.